Building and Sustaining SOAR Relationships with SSA and DDS. My name is Pam Hine. I'm a Senior Project Associate with the SAMHSA SOAR TA Center, and I will be your moderator today. Before we begin, just a few items to review. A quick disclaimer, this training is supported by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. The contents of this presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. The training should not be considered substitutes for individualized care and treatment decisions. Just a few webinar instructions. The slides, materials, and presenter bios are all available on the SOAR website, and you'll see the active link here. It can be found also in the reminder emails you received about this webinar, and you'll also receive an email after the webinar with a link to the materials. A recording will be available within a week on the SOAR website and later on YouTube. Questions, we'll take plenty of questions at the end of the webinar, so you'll be able to submit those through the Q&A feature. All participant lines will be muted and the chat feature is disabled. At the end of the presentations, there will be an evaluation and your browser will redirect you to a survey following the webinar. And today we're also offering two accessibility features today. So ASL interpretation by Lauren and Kip, and we also have closed captioning by Julia. So to view captioning, click the live transcript and select show subtitle. For ASL interpretation, you can pin the interpreter video by selecting the three dots in the upper right corner of their video. So it is my sincere honor to introduce Doreen Gross, PATH Program Coordinator and the SOAR Core with the Division of State and Community Systems Development at the Center for Mental Health Services at SAMHSA, who will give our welcome today. Doreen?
Thank you, Pam. I really appreciate that introduction. And a warm welcome to all of you joining us today. On behalf of the Substance Abuse and Mental Health Services Administration, or SAMHSA, I would like to welcome you to the SOAR webinar titled Building and Sustaining SOAR Relationships with SSA and DDS. One of our identified SOAR best practices for completing quality SOAR-assisted applications is building working relationships with SSA and DDS offices. To get this done, SOAR providers must work in collaboration with their SOAR state and local leads, and there's SAMHSA SOAR TA Center liaison. To help put this information into practice, we'll hear from SOAR practitioners, SSA and DDS representatives, SAMHSA SOAR TA Center staff, and a SOAR beneficiary who will share strategies on how they will work collaboratively to build sustainable working relationships. I would like to welcome and thank our presenters for your willingness to share your expertise and experience with building collaborations with SSA and DDS with us. A special thank you to our SSA and DDS partners who without your supports, SOAR would not be possible. So I'll turn it back over to Pam, who will be moderating today's session. Pam?
Thanks, Doreen. We truly appreciate you taking the time to be with us today. Thanks again. So here are some learning objections. So it's our intention that by the end of this webinar, you will have a better understanding of why building and sustaining relationships with your local SSA offices and your disability determination services, your state DDSs or DDBs are called some different things depending on where you are, how essential that is to implementing quality SOAR programs and how to apply the strategies that you're going to hear today from your presenters and learn about some of those tools that'll really help you get those conversations started and to sustain the relationships that you work hard to build. So our presenters today, we're so excited to have Sean Fordham, who's the Regional Communication Director for the Region 3, which is in Philadelphia with SSA. We'll have Georgie Fisher, who's a SOAR State Lead in Virginia, along with Millie Rothwell, who is with the SSA in Virginia. Then you'll hear from Kate Bash, who's a local lead in Washington, D.C., who will have a discussion along with Jennifer Ford, who was with the DDS in Washington. And then you'll also hear from Joanne, who's a SOAR beneficiary, who Kate worked very closely with, who will share their experience using the SOAR model and going through the process. So we're really happy to have Joanne with us today. And as I said earlier, we'll leave plenty of time at the end for Q&A. So right now, we are going to hear from Kristen of the SAMHSA SOAR TA Center Project Director, who will give you a little bit of a history and the importance of why developing relationships with SSA and DDS is really critical. Kristen?
All right. Thank you so much, Pam and Doreen and all of our presenters. I want to begin this afternoon by formally thanking our SSA and DDS collaborators, from SSA Central Office to the local field offices in each state DDS office. You all really do make this work possible. Like Doreen mentioned, we appreciate the time that you put into planning and instruction and support. We appreciate your patience that you give us and SOAR providers across the country as we ask questions and really work to improve the quality of the applications that we submit. We really value the feedback that you give us on how to work with you better and provide the information that you need. This support's really what helps make SOAR a success for the people that we serve. So thank you. All right, so you might think that after 17 years, we would just have this collaboration thing already down pat, and there would be little that you would need to do as a new SOAR provider ready to start SOAR. And since SOAR began, we really have been working hard developing and maintaining relationships at SSA and DDS, but it is always a work in progress. And it's this collective work over the years that's resulted in incredible collaborations, some of which you'll hear about today. But we've got these collaborations supported by staff at SSA headquarters, at regional offices and area SSA offices, because they recognize how important it is. And we work to continue those relationships and make them even stronger over time. We do that because it is so important. So SSA has an administrative style that encourages local field office autonomy, which really gives a lot of flexibility in the way things are done in local communities. Of course, they're following all of the rules and regulations as they need to. So it's that on the ground collaboration with SOAR happens when we've got that local field office buy-in, oftentimes with direction from area and regional offices. A note that, collaboration with SSA and DDS, it's almost never in writing, and it's through verbal communications and ongoing commitments. And it really requires careful, frequent communication, care, and maintenance. So a lot of it depends on you, the SOAR provider out there, and the assistance of your SOAR leaders. And you'll hear from SOAR leaders today who help maintain the relationships in their communities, and your TA Center liaisons who are there to support you through all of this process. So at the TA Center, we've developed some tools and resources that individual SOAR providers and our SOAR leaders can use to help with these relationships. And one of those key documents is our guide to collaborating with the Social Security Administration and Disability Determination Services. And this guide walks through different strategies for collaboration, things that can make the process work better for both the SOAR provider, the applicant, and SSA and DDS. And it talks about the benefits to SSA or DDS, the benefits to the SOAR case workers, and examples of how these strategies can be implemented. So we definitely encourage you to check out this tool. It can be very helpful in doing this work, and talk through some of these strategies with the SOAR leaders in your community, with your TA Center liaison as you work to develop it. So beginning the conversation with SSA, we get questions all the time. I'm a new SOAR provider. How do I contact SSA? How do I contact my field office? How do I get started? So we do have a tool on our website about what to do. Do we already have a SOAR process? Do I already have a SOAR liaison? Am I needing to help establish that? Do I need to, call someone up and introduce myself? And so we have this guide that you can kind of walk through to get the answer to some of those questions, and your TA Center liaison can definitely help you with answering them. And then as you think through, like, how do I want to build this collaboration? I'm meeting with my new SSA field office contact, some questions that you can ask them. What's the best way to communicate about applications that are being submitted? Who's the homeless coordinator for our field office? How would you like me to turn in signed forms? Who should I be sending the SSA 3288 to? When should I expect the claim to be transferred to DDS? All these good questions that will help your communication go more smoothly. It'll help with field office operations and can kind of benefit both sides. And that's what we're trying to do, is find ways that we can make this easier for everybody involved. And then on the DDS side of things, so beginning that conversation. So we have an article on the website with 5 tips for engagement on DDS collaborations, and some key questions that you can take to your DDS professional relations officer. You can ask, what's the best way to find out who the DDS examiner is on my application? I need to follow up. How can I get registered for Electronic Records Express? If I'm not using ERE, what's the best way for me to submit records with a barcoded cover sheet? So these are just some key things that you can ask to help you get started in some of these conversations and get the ball rolling. And you'll hear from our presenters later in this presentation about what they've done, how they've gotten past these questions, and even beyond in their collaborations. So with that, I am honored to introduce Sean Fordham, who's the Social Security Administration Philadelphia Regional Communications Director and a wonderful partner to SOAR, both in the region and nationwide. So I'll turn it over to Sean.
Well, thank you. You know, when you talk about collaborations, right away you say, what's a communications guy doing in a collaboration that seems to be more like operations? But this is what we do, because in my role as the Regional Communications Director, and specifically our office, the Regional Communications Office, we have been named across the country, and there are 8 others that do what I do, are considered the ombudsman for the agency. And the definition of that for us is we are responsible to handling any complaints, difficulties in folks being able to reach an office, organizations that think they are not getting responses from the local areas, or making sure that folks get together and talk. So we stand here as kind of a backstop to what you'll hear later in the presentations about actual examples of collaborative efforts. We stand from the regional office as those that are there here to make sure that if you're not getting cooperation or you're not hearing back from particular areas or offices to work with you, then that's where we step in to make sure that they are responding and doing things in a way that will help you be able to do things better. One of my favorite things, is a movie, Jerry Maguire, where it's a little scene where he says, "Help me help you, help me help you." Well, I want to thank you for helping us be able to help you help us to help the folks out in the community that actually need to connect with us. So we stand, as the slide says, there to give guidance and support to our local areas and operations in regards to those that are in SOAR and working with SOAR. We participate in the monthly or the quarterly meetings for Region 3, which includes Pennsylvania, Maryland, Washington, D.C., West Virginia, and Virginia, and allowing folks to be able to collaborate and have that safe zone where if there is a problem and you feel like you can't work it out at the local area, which we think you can, because I think our areas are very, very appreciative of these collaborative efforts. We want to stand and be available from the regional office to help do that, open up doors, create bridges, work out problems, to allow you to be able to effectively work with those local offices We can even help with problems with DDS if it comes up. But that's what we're here for. And I don't have a whole lot more than that other than to just be able to say as a regional office, we fully support SOAR activities and appreciate what SOAR brings to the table and working with all of the organizations that are at the table. And I'll throw it back to Pam.
Pam, you're muted.
Thanks. Thank you, Sean. I was just saying other Jerry Maguire references, let's say, show me the collaboration. You have done so much with enhancing the partnerships, answering all of our questions, sharing contact lists, just keeping things moving, your public affairs specialists and yourself. So we thank you and value your partnership. So now we're going to hear from Georgie, who's done so much in Virginia to promote these partnerships. And we're going to hear a little bit about what is her magic sauce, with building these relationships. So I'm going to throw it over to Georgie.
Thanks, Pam. Hey, everybody. I'm Georgie Fisher. I work with the Department of Behavioral Health and Developmental Services in the state of Virginia. And as Pam mentioned earlier, I'm also a SOAR state lead for the state of Virginia. And joining me is Millie Rothwell, and she is the SSA Area Work Incentives Coordinator, or you'll hear us say AWIC, in Northern Virginia for Springfield specifically. That's her working title, but I will call her an angel, a saint, a number of other things. And you'll hear from all of us on this call today. We sort of all work together in the same region and have overlap in the work that we do. And as Sean mentioned, we're really, and I think Kristen and Pam, we're really indebted to SSA and DDS for the collaborative efforts that they, bring to the table and continue to just work with us on. And we're going to talk a little bit about that, sort of what's happened in Virginia and our area, and how we got there. And before I get started, I want to say this. So I'm working in a state role now, but I started out in SOAR as somebody doing direct services work with people through permanent supportive housing, and started off just doing applications for SOAR for folks, and started making contacts through that work. And so when I moved into this role, I knew folks, and we were able to sort of start having these conversations. So you don't have to just sort of be a state lead or at a state level to begin having conversations with SSA and DDS to get the work done. So I'll talk a little bit about the structure of SOAR in Virginia. Millie and I are going to do this together because we do this work together. And a lot of this backbone of this structure was built off of sort of a design that Millie had come up with in Northern Virginia that was working really well for us, that we expanded to the rest of our state. And so Virginia is a little weird. We have sort of part of us is Northern Virginia that overlaps with DC and Maryland. And then we have a second region which covers the balance of our state. And so for us, for SOAR, we utilize a collaboration between our local Social Security offices. So those are the offices in your backyard. Our area work incentive coordinators, or AWICs, like Millie, and our public affairs specialist, or PAS. We are assigned a specific person or contact, whether it's an AWIC or a public affairs specialist, that assists us with tracking claims for programs, for assisting with any barriers or issues that come up. And that can include, hey, I don't understand how I'm supposed to submit this, or hey, Millie, I submitted this claim and I can't find it anymore. Or, hey, Millie, I'm getting this response back and I'm not understanding what that means. Can you help me understand that? And so we have appointed contacts with Social Security and DDS in our state for each region that oversee the SOAR process. And Millie is one of those folks for Northern Virginia. And to help us identify these claims, these SOAR claims, when they come into the local office, we have utilized specialized cover sheets that have been designed in collaboration with the SOAR TA Center and with Social Security that have information on them that assists the local office when the application reaches them with identifying and routing claims appropriately, identifying them either as SOAR claims and getting them sort of to the right people. And so similarly, our DDS claims are tracked the same way that I just talked about SSA claims being tracked. We have specific contacts, 4 of them across the state that are in regular communication with SOAR workers. And so when a SOAR claim is submitted to the local office, an email gets sent over to that pro or professional relation officer. They have a spreadsheet of claims that they track, and then they'll come back and say, hey, Georgie, it's been 30 days and I haven't gotten an application. It hasn't come over from SSA, just checking in. And those pros work with analysts in specific SOAR units to assist with processing our applications. And so what that means for us in the state of Virginia is that disability determination has created special units in each region of seasoned workers who specifically track and process our SOAR claims. And so when an application is submitted to the local office and then goes over to DDS, it'll go into one of these special units, or we call them SOAR units. And Millie can talk a little bit more about what the background of that looks like. So when we send that application into that local office and alert Millie, hey, it's happening, what happens after that?
Yes, Georgie, thank you so much. And thank you, Pam, for inviting us, Social Security, to this wonderful webinar. And it is correct, we do have a collaboration, with, DDS, and we also have a collaboration with the state coordinator, but we also have other key players, right, that help us to make this, process very successful. And that is that we have SOAR liaisons also within all the field offices that we have. We also have, the DDS Pro, which is Vida Cyrus, and we keep each other in communications. And thanks to the SOAR case managers, we actually have developed some sort of like a streamlined process where that case manager sent us an email, and then from that point, I look at the case. I kind of look not only at the case, review the case for having all the forms and all the paperwork that we need, but my job is also to look and kind of screen the case to ensure that that individual is also applying for all the entitlements that that person is actually entitled to apply for. So I look for those little things, and if there's anything that I can actually that I need, I will send an email back and let the case manager that I need some sort of application. But also, if the case is completed, the package looks good, then what I do is I send an email to the local field office liaison with the information about the protective filing. I also send information about the date first insured, date last insured, to make sure that that individual is well knowledgeable about what that person needs to do. And once that person receives that package, receives my information, they actually upload the application and then send that application to DDS. We send that emails with each other, letting, Vida Cyrus, which is the pro for DDS, know that there's a case coming, and Vida is very proactive about, assigning a actual SOAR medical examiner to that claim. And then after that, Vida also takes the opportunity to send an email to that case manager, letting them know, hey, I have assigned the case to this individual. You can email this individual, request a barcode for medical records or anything, like that. And I think that the process that we have for Area 3, and also the same process is actually used for DC and also Maryland. And it's been very successful. And we actually work well together. We communicate well with each other. We provide feedback. And I think that is, if we have to make changes, we can do that. We talk about it, and then we also have our continuous, meetings, emails, and communication. And I think that this is the key for making this process very successful, is that we communicate consistently. We communicate on things that we need. We also communicate on things that, we want to kind of like look and revise to make changes. And I think that, Georgie is, a wonderful person. And we work so well together, at a professional level. We just get along perfect. And also even at a personal level, because we really care for each other and we really believe on what SOAR is all about.
I think one of the things that's important to say and backtrack this a little bit is when we, started trying to move this effort across our state, we were having a lot of issues with claims getting like submitted to Social Security and then not necessarily making it to DDS or getting flagged as SOAR or having the claims sort of moved forward in the process. And this way that Millie devised this sort of system for how we track things that's now spread to the rest of the state and we've been using for a few years has been really helpful, not in just making sure that the claims sort of move forward and we get through in a timely manner, but as she mentioned earlier, she can help us recognize if there's something that we missed with the application package, there's additional information they need on the front end, and then help sort of maintain that contact with local office to say, hey, here's all the information about the claim so that everything gets inputted and then it's moved over to DDS. And I will say, this process, how we do things in Virginia with submitting claims is maybe different than how it's done across the country. But our specific process is that we work to do the pieces of the application online that can be done online. And then the rest of the packet is submitted via fax to our local office. Again, using that checklist, that cover sheet, it gets sent into the local office to work track. And then we give our liaison a heads up to let them know that's landed in work track and they help with routing it from there. And like Millie said, our workers email the pros saying, hey, this is what's going on. I've submitted a claim, just giving you a heads up. They either call or email the name, SSN, submission date. But also, Millie's making that contact with the pro too. So Social Security and our, DDS professional relations officers are having that communication too to bridge that gap so that they are in communication about claims. And I will often get emails from them saying, hey, from our pro that's like, hey, Millie, we talked about this application 30 days ago or 20 days ago, and it's not on my desk. And so they have that communication back and forth too, to make sure that the applications are sort of flowing correctly. The other part of that I really appreciate as a state lead is when we come into this work doing SOAR applications, like I've been doing it for like well over a decade now. Sometimes there are things that I'll still forget, or there's things that new workers will not have submitted. And because they have eyes on those applications and they're turning them back over so, quickly, they're alerting the worker, hey, you forgot this piece of information, alerting me, hey, this worker may need some extra help processing. And that lets us work together, one, to make sure we're serving our clients who are incredibly vulnerable to the best of our ability, and also taking the workload off of, SSA and DDS of them having to wait for us to come back and figure out that we've forgotten forms and things like that. And it goes all down to just building these strong relationships. I will tell you guys, I came in, and I apologize now, and they kind of laugh, but I came in to this role, like having done SOAR in the community, and just came in with lots of asks, right? Like I came to the table just asking for the moon. And SSA graciously did not like send me packing on my way. Instead, they've worked with us to create these sort of collaborative efforts on how we can make SOAR work the best that we can in our community. And so let me say this, our folks, our contacts, our POS, our AWIC, our pros, they're all available via email and phone to SOAR workers at any time. They shoot off an email, there's a response back, within sometimes minutes, an hour. I have a standing meeting as a state lead with SSA, with our SSA area director's office, with Millie. We discuss and troubleshoot every month, what's working well for SOAR in our community, what do we need to figure out what's not working well. And we have that like standing date to talk about, collaborate, figure out what's working well in our community. Also, our state has bi-monthly meetings by region for SOAR workers, and our regional contacts, our POS, our AWICs, our pros are all on those meetings. They're coming to the table saying, hey, these are the things to be looking out for, or these are some of the issues that we're having. They also graciously answer questions about claims or troubles or issues that people are having in that region. And so they're not only just sort of overseeing this process, maintaining, communication via email and phone, but they're also showing up to our meetings and helping workers across the state with that process. One of the ways that we've also been able to maintain this communication is through our leadership summit. It's something that we developed with a TA center we get together. We have another one coming up in September. I'm really excited because I haven't seen, I mean, like Millie, I haven't seen in 2.5, 3 years in person because of COVID. So we get together at the table over a couple of days with DDS, SSA, and our local SOAR leads, and we just talk about like what's working, what's not working, what do we need to do to make this as effective as possible in community. And I would say like that gives us time away from all of our other duties and things to just sort of be in a room together and come up with, you know, ways to make SOAR stronger in our community.
Also,
Um,
Georgia,
yeah,
I'm
go
gonna
ahead.
add something to this is that also you empower the case managers to actually communicate with us independently and sometimes resolve things, you know, within each other without having to involve you, you know, every single moment, every single time. And I love the fact that, you know, the case managers are very good about asking questions and following up with questions, and also providing, you know, documentation or anything, and even assistance with representative payees, giving us, you know, information, and they're very proactive. So I think that overall, you know, we're very successful in what we're doing right now, and it is because we care, we're committed, we're doing this as a team. And you know what? I love my area. I love what we're doing. I'm very proud, but I also serve the DC and Maryland, that they're also very successful and wonderful, you know, people to work with. So all case managers should have, you know, kudos to all of you guys, you know, because you guys do a hard work and a hard job. And I remember being part of the training for the SOAR and in DC, and I remember how elaborate and how intense training they received. And at that point, I realized how important this is for all of us, and to support your cause. So it was, and I understand there's a lot of time invested on this, and that's why I'm committed to all of you guys and the case managers, and also our clients, which is the most important thing. So having people, you know, in partners and collaborating in things like this makes me feel very good. And that's why I strive, because you guys are giving me the opportunity to do all this for you and the clients.
Yeah, I think you can tell that we have like a mutual admiration society here with the work that we're doing. And so, you know, we've talked a lot about like what our structure looks like, the fact that we're in constant communication and collaboration with each other. You know, we recognize that there are challenges, you know, across the board, SSA, DDS, you know, workers in the field. There's been lots of challenges at the table that folks have been facing. And, you know, we come into this work, you know, collaboratively with gratitude for each other, understanding that we're all facing really tough situations, and continue to welcome and solicit feedback. I'll say the other part of this for us is that we try to celebrate success. I laugh when I say this, but you know, like we do these awards, you know, recognizing SSA and DDS partners at our annual Housing Virginia's Most Vulnerable Conference. And I always say, I love you guys so much. I'm sorry that the only thing I'm doing is giving you a piece of glass, right? Like this award. But we try to celebrate our wins and do it in a way where our partners, you know, recognize our gratitude for that, recognize and celebrate the successes, you know, yearly through our outcomes at our local meetings. And that SSA and DDS, well, we get to see people face to face, that they're getting to also realize the difference that they're making in the lives of people that they're not necessarily meeting, but they're having an incredibly huge impact on. And so I think we're butting up against time. And so we'll, I think, you know, for us, what I'll say is ask for the moon, come into relationships collaboratively, and realize that we're all working in the same direction. I think that served us really well, you know, in our state. We're incredibly grateful for the partnerships that we do have with SSA and DDS.
Absolutely.
And I think we'll pass it back to you, Pam.
Great. Thank you, Georgie and Millie. And I love how you did focus on that you work through the issues together, and you really raise those 3 C's of SOAR: communication, consistency, and collaboration. And we have questions that are pouring in that are directed to both of you that we'll get towards the end. So thanks again for your wonderful sharing of your working relationship. We have a couple of extra slides that we'll get to. So now we're going to throw it to Kate, Kate and Jennifer Ford, who are going to really talk about their relationship. We talked a little bit about SSA, that the local SSA office and the area offices. Now we're going to talk about the state DDSs, where the medical determinations are made. So Kate, take it away.
Okay, well, thank you to the SOAR TA Center and to Social Security and DDS for being our partners in this work. And I just want to thank all the claimants who trust us to partner with them in this work. My name is Kate Posh. I work at Friends of the City in Washington, D.C. I've been trying to do SOAR work since about 2016, and I always say I've been trying because for about the first 2 years, I didn't understand the difference between SSI and SSDI. So I've since corrected myself and continue to always try to improve my SOAR knowledge and just the ways that I can use the model to help people get benefits. So I wanted to talk a little bit today about the ways in which we do that in DC and some of the philosophy that we use. I also just want to take a quick minute to thank Georgie and Millie as our senators in Virginia. We collaborate with them a lot in numerous ways. And I think one important takeaway from this webinar is the SOAR community is a strong network, and we can make it stronger with communication and collaboration by identifying who those key people are in the network. And Georgie and Millie have definitely been some of those people. So just want to say an extra thank you to both of you. So when I'm trying to advance myself, but I'm not able to, Susie, would you mind advancing? Okay, thank you.
Okay.
Yeah, and I'll try to remember to advance them. So when building and sustaining our work, I think that understanding who the key people are and what the key principles are is really essential to utilizing the SOAR model successfully. It's really a process of knowing who to communicate with and when. And I think kind of first to start using the process, we have to think of ourselves as the SOAR case manager as key in that process. Nobody else is going to be gathering the information except for us. So we really are like a hub in the process, gathering all the critical components. And I'm sure everyone's familiar with these critical components, but it never is unnecessary to remember these and to remind yourself of these are all the things that make SOAR unique and that make it a successful model. So it is our responsibility as the SOAR case manager to be proactive and really coordinating and staying on top of all of these critical components. And then also being proactive with our communication with Social Security and DDS and medical providers and claimants. And then just remembering the ultimate goal is to link the symptoms to the functional limitations by using this key role that we're in. So really making sure that we are recognizing our role in that and then linking to the other key people in the process. Next slide. I think another, sorry, next slide, Susie. Thank you. So I think another important takeaway to think about when building relationships with DDS and also just utilize the SOAR model is to, sorry, can you go back one slide? Is to think about the SOAR process itself as being a key. And it's key in bringing in all the domains of a person's life to demonstrate the evidence that might not otherwise be brought together. Because we know as SOAR case managers that not all disability evidence exists solely in medical records, but we need medical records to substantiate the disability. So successful SOAR collaboration, at least in my mind, is a lot about knowing the what, the where, the who. So what the functional limitations are, where it's demonstrated, if not solely in the medical records, and then who can help you substantiate that to show that it is medical evidence, and then who are you working with at DDS that you can collaborate with to do so. So oftentimes I will get records or evidence that's maybe in some court documents, but those are not medical records. So I'll work with the DDS examiner on that claim to say, hey, there's this, and I know it's not medical evidence, but could we get a consultative exam because I think this demonstrates there might be actual medical documentation that can be got about this. So really remembering how to bring the SOAR process together is key to demonstrate how you can help somebody get better. Next slide. It definitely takes time to do this. So the DC SOAR community is very small, but we've been using the SOAR model for many years, but we've not had clear or formal coordination until around 2016. And there was a group of advocates and case managers and people who cared about helping people get benefits that met pretty regularly, almost like a SOAR steering committee, and then eventually realized that things were just not getting through to our contacts at Social Security or contacts left. And so around 2016.
Hey, this is Pam. I'm sorry to interrupt, but your sound is going in and out. There's a lot of crackling. So I'm wondering if you could just move a bit closer to the mic. That could, alleviate that problem of the crackling noise.
Sure, how's this?
Yep, sounds good.
Great, thank you. So basically around 2016, our group asked the SOAR TA Center for help identifying who we could talk to at the Social Security office to try to establish some more formal processes. So in just thinking about the key people, just remember that your SOAR TA Center liaison is really a key person in helping you get your foot in the door if you really can't find another way. And so around that time, we were put in touch with the then local leadership at the Social Security office. And we were able to start having meetings and discussing just like what SOAR is, why we're trying to establish something more formal with them. And then hearing from Social Security and from DDS what they need, because like Georgie said, you can ask for the moon, but they can't give you the whole moon. So they need a moon too. So being able to come to the table in some form or fashion to really hear each other is important. And through that, we're eventually able to establish SOAR liaisons at each of our local offices and at DDS. We're able to outline a specific process for how each office wanted to receive SOAR applications, and then coordination we would do at DDS. One thing that's different in DC from Virginia is that because we're so small and we have just less providers and less population, we don't have a SOAR unit at DDS, but you'll hear from Ms. Ford, who essentially is our SOAR unit at our DDS, and that is just, again, highlighting the point of like finding who that key person is really essential. And so on this slide, I just wanted to offer some examples of the ways that we've identified collaboration in DC with our Social Security and our DDS. And these are some things that have come out of working together over time. One example I'll just point out is that we don't have like a SOAR flag that we can use, so we don't use a cover sheet, but our process of submitting applications, anytime we have an application that is SOAR, we ensure that there's a homeless flag on it so that when it gets to DDS, they will know that it is also a SOAR case that we're working with. So we're using the homeless flag kind of interchangeably. Next slide. And so all of this really is a work in progress. And I think there are things to remember. One of the big keys to remember, so we're the case manager a key, the SOAR model is a key, identifying your people at Social Security and DDS is a key, and grace is key. We really, in DC, were given the idea by a really awesome advocate who's in Virginia now, this idea of gracious persistence. And so really try to remember that throughout the process that we're being proactive with, that we have the same goal as the client. We have the same goal as Social Security and DDS. And in our communication and our collaboration, we have to understand that. And we have to remember that DDS has the expertise on how Social Security's rules and regulations are applied to medical evidence. So really deferring to your examiner and collaborating about what else is needed, or just making sure that you've demonstrated everything you can is important. And being gracious in doing that, asking, not telling. We also, as the SOAR providers, working with people day in, day out, we currently know what the circumstances are, what their current day-to-day life is. So we have that ability to paint the picture about the day-to-day, and doing that graciously, but showing where the limitations really are. And I just really think an important key to remember is that we're learning together in every case. Nobody knows everything about Social Security, and every case is going to be different, and we'll have new things to teach you. So allowing yourself and the DDS examiner and Social Security the grace as you're learning together, and keep asking questions. If you don't understand something, ask. And if you don't know exactly who to ask, talk to your TA center liaison, or talk to your Social Security liaison, talk to your DDS liaison, and ask who the person is that could help you understand if you're not understanding what maybe the problem is, or the troubleshooting they need to have done. Also, really, again, being proactive, like we've talked about, is important, and checking in and following up. But I think when we're talking about being grace as being a key, it's important to not be annoying and to remember, don't become an adversary. Again, our goal is the same. We want to help people get benefits. And we have to do that by demonstrating how to meet Social Security's definition of a disabling condition. And we're doing that using the SOAR model. And just lastly, I think remembering that holding yourself accountable as being one of those keys is important. So like doing the work to understand what's needed to demonstrate what the disability is. And if you can't do that through just medical records, or you can't do that just through medical summary report, how can you show that in other ways through other evidence that might be existing there? So really doing the work to understand what's needed is key in that work, and giving yourself the grace and the time to do that, because it is a process. This is a long game. Next slide, please. So like I said, we're learning with every case that we're doing. And a key person in DC that we work with, and I think one of the best teachers that I could ever ask for, and one of the best collaborators, is Miss Ford. She is our DC DDS SOAR liaison. She is the hub, the key person. She is the SOAR unit in DC. And any case that comes through DDS that is a SOAR case usually goes to her. And if she can't take on the case, then she will let us know who it's assigned to and how to get in touch with the examiner. And she just really understands the SOAR model and why it exists and why we're trying to help people and why we use it. She's extremely thorough, super communicative and responsive, very organized and collaborative. We work together a lot in just developing evidence or finding where medical records might exist when someone might not have told us about them. And she's really open to questions. So I really appreciate being able to work with Ms. Ford. And we've worked together, I would say, probably since 2016 or 2017. I actually don't know anymore how long we worked together. But I'm really glad to be able to introduce Ms. Ford. She's the Quality Assurance Examiner at DC DDS. So Ms. Ford, take it. Thank you.
Hi, everyone. Can you see and hear me?
Yes.
Yes.
We can.
Thank you, Kate. I appreciate that. I don't know how long I've worked with you either. I've been there almost 20 years. I lose track of time sometimes. So as you can see, I'm Jennifer Ford. I am in DC. DC is a relatively small office. And as Kate said, if I can't take the case, I can see who can get it. We have, I think, about 20 examiners, maybe. So again, can't take them all. And if I don't get it, I share with somebody. Someone else will get the case. Again, thank you, Kate, for that feedback. Is appreciated. Next slide, please. So I'm going to give you and go over the very basic definition of SSA disability. And it's really basically if you have a physical or mental impairment that you will die from or will last more than 12 months and prevents you from performing any SGA or English working full-time. It's important to remember that the SSA definition of disability is different than how the VA defines disability, and even vocational rehab defines disability. Sometimes that gets a little confusing for people, but for SSA, it's any impairment or combination that prevents you from working full time and is expected to last at least 12 months or result in death. Next slide, please. So if someone has a mental or physical impairment, there are certain impairments that if you have the medical information to support it, automatically meet the listing. The listings are impairments that once the deaf information is present, that you will get benefits. A quick example of an impairment that meets a listing, used to call it the blue book, is someone who needs dialysis 3 days a week. That's an automatic allow if you have the documentation to show that the person has kidney failure that requires dialysis and that dialysis is required 3 times a week. You need to have it signed by a doctor for MDI or medically determinable impairment. But if you're ever curious about what conditions automatically meet, check the listings. And if the condition doesn't meet the listing exactly, at least you're able to see what it compares to, because you can also equal the listings. So the link is up there for it. Again, the best example is someone, the fastest one I can think of is someone who's getting dialysis 3 days a week, automatic allowance. Next slide, please. The biggest and the pretty much most critical thing is getting medical records. If we get a case, for example, today, and all the records we need are in the case today, we can close the case today. Many times the delay is getting the medical records in a timely manner, and that's where SOAR comes in handy. You guys are very quickly able to get records. The records function to determine if the person meets SSA definitions of disability. It's also very important to remember duration and severity are very important. SSA likes to have documentation for about a year from your onset date. If you say, for example, you're depressed today, but don't have treatment, don't have records, your doctor hasn't mentioned it, you're not getting any medications, there's nothing to substantiate it, it's hard for SSA to process an allowance without having that information available. Next slide, please. Beyond getting the barcoded cover sheet we can send you, if we have a 1696, we are able to we can get records fast through ERE, Electronic Records Express. The usual easiest way to do it is to ask for the office medical relations and professional relations officer. They deal with all types of issues, dealing with getting medical records, getting exams taken care of. And if you give a username and an email address, you're able to get records in faster than if you had to mail it to us. And even sometimes if you have to fax it to us. Next slide, please. The benefits of ERE are pretty clear. You're not sending it through the mail. Saves time, saves money. Things get lost in the mail, as we all know. The records get uploaded very quickly. So as soon as you get the records into us, it's in the claimant's case, and the delay is not with the records coming in. Next slide, please. In terms of case development, again, medical records are pretty critical and very important. The faster you get the records, the faster the records are received. If the records provide us what we need, we're good to go and the case can get out pretty quickly. It's important to have a 1696. If you don't have that, we have limited communication with what we can share with you due to HIPAA and privacy laws. It's definitely important to get forms sent to us timely and definitely thoroughly. If there's a change with phone number, address, it's important. I also, with the SOAR cases, I get a lot of the homeless claimants, and I always stress the importance of having at least a reliable third-party contact if the phone number might change here and there, things like that. If you guys have any type of additional evidence, please do let us know. We can request it. Oftentimes, you guys get it before us, to be quite honest. In my experience, Kate's gotten a lot of records before I've gotten them. And finally, in terms of the examinations, if we set one up, please do try to attend. There are sometimes delays in getting the exam scheduled, and that can add 30 to 45 days, depending on the state and depending on type of exam. So if an exam is ordered because the records are either insufficient or if the records haven't been received yet, please do attend those exams. It's pretty important. That's all I have for you guys at this point. So I'm going to turn this back to Kate and our special guest.
All right. Well, thank you so much, Ms. Ward. We really appreciate you. And so now I'm really happy to be able to introduce Joanne. We've been working together for about a year, and she offered to share her experience of just what deciding to apply was like, asking for support to partner to apply, and just what going through the process was like. So we're going to discuss briefly kind of what it was like, and if you can't hear us, please let us know. So thanks, Joanne.
Hi, everybody. You're welcome.
So just kind of off the bat, what brought you to Bryn for Social Security support, and why did you want to apply?
Well, I was a patient here, and I had recently lost my job. My body was going through so many things. I'm homeless, and I didn't know what was going on because I'd never been in that situation before. Another organization supposed to be helping me. I got so upset, and somebody pulled me up from Bridge to the city and said, "We're going to help you," and they introduced me to Kate Bosch. So that was the best thing that could have happened for me.
What was it like to decide to apply after we talked after that first kind of meeting and usually in a first meeting, I'll talk about, we're going to do some screening, I'm going to collect some medical records just to see how I can help you make a case. What was it like?
I was kind of reluctant. I was like on pride and discouragement all at the same time. I had a pretty good upbringing. I had a pretty good husband, and I just couldn't understand what was going on. I get on job to jump to another, but this time it was different. My mental, my physical, everything was just off, and I did not trust anyone. So Kate talked to me and she said, "Oh, we're gonna get through," and she showed me some of the paperwork, and I was like, "Oh," and because my writing, it's like I just lost everything. Everything that I could do, I really couldn't do. And so she said, "I'll do the writing for you," and I said, "Okay," and I did everything that she told me to do, even in pain. I did it. I just, whatever she asked, I did.
And there was some flexibility, I think, in the process, but what was the process like for you? Just, when you saw that paperwork and when I kept calling you and asking you all these questions and doing all the meetings just to get the application done?
Well, I knew it was so many different sources of Social Security, but my thing was about the widowers, and I was just told that you have to wait till you get 60 or whatever. And then Kate started explaining to me about other things and asked me for medical records, and I gave her everything, and she just explained to me that, I'm just gonna apply for everything, because we didn't know where we were going, because I didn't even know where I was, but Kate figured it out. and it's still a process. Even though I have it now, it's still a process. Being still homeless, but I feel so much better now because I don't have to stay somewhere I don't want to stay. I can go to a home if I want to go. I can just say, "Hey, I'm going to stay a night or something." Life is so much different now. I dropped my pride, and I'm happy that I went with the Social Security process. I've learned so much just from this. I learned so much from KG lesson. I mean, I've been wanting to cry tears now instead of crying, just crying. So.
Well, the feeling is mutual, and just like Georgie had said earlier, this was a learning process for me as well. And what Millie was pointing out about doing some of this thing up front to find out what people are entitled to apply for, that was definitely true in this case, because there were things that I didn't know Joanne was eligible to apply for. So we were able to learn that together because of the key people and the partnerships that we have with our SOAR liaisons at Social Security. So I don't want to make you talk forever, but is there anything that you would want to tell anybody who's considering applying for Social Security? And can you speak up to make sure you're
I would first tell people, you know, drop the pride, be honest. If you don't have something, you're not aware, ask questions. Take the steps and follow instructions. And even, you know, with my health reasons, I can't always be there. I couldn't always do, but I would call her and I was like, hey, I can't make it today or whatever. And she said, don't worry about it. We still got time. Or it's just, you know, everything she gave me was just so helpful. And I'm not one to ask for something. I just go get it. But now I know how to ask, and I believe that there are people out here that can help you. And the Social Security was, you know, my parents like, you did this, you too proud. I said, no, I can do this on my own, leave me alone. But I found out that's not true. And I will recommend, as a matter of fact, I'm sending Kate right now. She can't even take the cases. And I've learned that every case of Social Security is different. You know, I grew up with my parents with it, but it's not the same. Mine is not the same. Somebody else is not the same. And I will always thank Social Security because we were 6 months. Everybody said, wow, you did this in 6 to 7 months. I said, no, Miss Kate Bosch did. It's just 6 to 7 months, but it was an effort.
We did it together, for sure.
We did it. I told her I'm not a hugger, but I had a hugger a couple of times. I mean, but you know, it's a wonderful experience, and I'm learning a lot from what you do, everything I'm listening to right now. It's an honor, and I thank y'all. My brother always told me, say, you want something, go to Bread of the City. And not only did they help him, he helped me. My brother, he's deceased now, but he something, you just go to Bread of the City, like, boy, but he told the truth. You know, he did the same process. So I you know, followed in his footsteps.
Well, thank you. And it definitely, I mean, it was something we did together. And as a SOAR case manager, something that I usually tell folks that I'm working with is, we don't know what's going to happen. I'm going to knock on wood. And I always say my head is the wood, and we're going to do our best. And you're going to do great. And when you don't have the hope for this case, I'm going to hold the hope for you. And I think that's a really important part of being a SOAR case manager, is that you believe the case and that you're going to hold up the hope that you're going to show how this person meets Social Security's definition of disability. You're going to keep trying if you get denied. And you're going to understand why denial happened and keep working on it together. Because that's what SOAR is. SOAR is about helping people find hope to move forward through a process that's pretty confusing. That's why there's a 20-hour training on the SOAR model, because it's not a straightforward process. And so part of our job, again, when we're taking on that key role, is to understand what the different parts are and who the people are that we need to talk to help move through the process. So thank you, Joanne, for working on this together.
You're welcome. I was going to say, like, I was ready to sell half just to have some income. Miss K said, no, we going for the whole. and I was saying to myself, oh, she can't do it. But she did it.
We did it together.
Well, thank you.
Thank you. All right, should we turn back over?
Yes.
Yeah.
Great. Thank you, Kate. Thank you, Joanne. And it is about working together. You know, like Sean said, kind of bringing it back to Sean as we prepare for our Q&A. So I'll ask all the panelists to camera up and allow you all to pose some questions in the Q&A box. And we already have about 25 questions that came in that we've been packaging up, and many have common themes. And it is about, how do we work together, especially during times of challenges, whether it's your own agency with staffing and resource challenges that we know that SSA and DDS have as well. And using Kate's gracious persistence in understanding that we all have challenges. And the SOAR model is really about how do we use this process to improve efficiencies and, develop and submit a quality application so that we can help SSA do their job as they help us do our job. Like Sean said, going back to Sean, help us, help me, help you. I think that really brings it back, to that we're all in this together, working together. We all have similar, we serve the same population and we have the same goals in connecting individuals to these, transforming benefits of Social Security. So as we have some of the questions come in, there was a theme about Social Security offices. What can SOAR case managers do to expedite decisions at DDS? What can we make sure that our applications include so that at the SSA office, you can make that non-medical decision to get that application packaged up to send it up to DDS. So Jennifer can make, a fair decision and not have to recontact the applicant and such. So it's kind of a general question, but many people are asking, what can we do? I think it was Georgie that talked about, using online services, and Jennifer talked about enroll in ERE. So can you expand maybe on some tips that, and I will start with Sean, maybe Sean and Millie, from starting with the SSA, what can case managers do to make sure their applications are complete?
I would like to, take a shot at that first. One thing, and this is from a field office perspective, is both, and understand, I've had almost every job that you can have with the agency, from service rep to claims specialist to operations supervisor, public affairs, assistant district manager, right? One of the things, and to piggyback on some of what was explained about the disability process, but what I instill in my folks in the office, which handle claims, which I think is beneficial to you, is we get that in the field office, most of our folks that we interview are not going to meet a medical listing. A lot of them don't. So we're relying on getting enough information for that sequential evaluation. And that sequential evaluation, each one of those conditions separately may not be enough to qualify a person to meet that definition of disability. But when you look at a sequential evaluation, which it looks at the age, the experience, but both what they might be qualified to do or be able to do in the workforce. But when you look at the combination with their education level and their age, with all of the conditions they have that may not be connected to each other. So you may have a person that's got bad knees, but at the same time, they've got a heart condition that may not be severe enough on its own to qualify a person to meet that definition of disability. But when you add up all of the other things, migraine, headaches, and all of these other things that they have, and then even some of the side effects that they may experience from the medications that they're taking for some of their other conditions, once you start adding that up, it becomes now more of a package that I think the DDS can use to make that decision, or even the appeals office later. A lot of times a person is so focused on what they think that main condition is that they leave out a lot of information. And what I've always taught my claim specialists and my service reps that work through me in the different offices is, when they start listing out their medications, figure out what those medications are for. Ask them, because they may be getting treated for something that they didn't mention when they were saying what their condition or what their disability was. And by the time you get through those medications and you find out, oh, they got anxiety disorders, they've got a sleep disorder, they've got all these other things. That list of conditions went from 1 or 2 things that they may have mentioned in their initial claim to 10 or 12 different things that now give a bigger picture, a greater picture of a person that may not be able to work, at that substantial gainful level. So I just wanted to add that because I think that helps when you get that complete picture, not just stopping at whatever that main problem is, but looking at the breadth of what they may be experiencing. I think that's one of the biggest things that can help.
So what I'm going to do is I'm going to actually add to what Sean actually is saying. It is very important also to not only add mental impairments or also other impairments. For example, if the person is actually blind or is hearing impaired, please ensure that you are adding all diagnosis, known diagnosis, and also medications, and leave nothing unturned, because not only we're going to we don't want to focus only on one thing, but we also wanted to focus on the overall aspect of how this individual is functioning and how this individual, how their impediments, the medical impediments, are, impeding that individual from working. So that's very important. I just signed a case that I was just mentioning to Georgie, that the individual was actually approved for SSI, but the person actually had a diagnosis of being blind, and we had it on a previous record that person was a stat blind. So that means that the insurer status for that individual expanded to in the future, so we could have actually approved this individual on the Title II, which is SSDI. So we have to go back and send that case to DDS because that person claimed to be stat blind or blindness. If anybody claims something like that, add it and we will send the case to DDS. And that's important.
I know that was an overarching question, but it kind of, the gist of some of the other questions that folks were asking were about that. And I think it's a great plug to bookmark the SOAR online course so that you can use it as a resource, as a reference. Many folks are asking for, how do I find information about that SSA 3288 form, the consent for release form? And we do have, and how do we create a SOAR process that may be written? Not all are written, but again, one of the tools we have is and we revamped our standard SOAR process. And I know Georgie has one written down. So things like that can be really, really helpful for you too. And we'll share the link on how to access those resources as well. But again, just a plug to bookmark the online course. That's where you're going to find the link for the blue book and many other helpful resources there as well. Well, we did have a question about what is the best practice if we have a contact who is a contact at our, let's say our SSA field office or our DDS adjudicator, or you mentioned the professional relations officer. What is the best practice if we have a contact who is, and that's great that you have a contact, who is non-responsive? What would be your first steps in trying to, find a contact or make that contact more responsive? Maybe Georgie, I see you thinking.
So in our state, we have a process that's been set up for that. So if I don't, so say that I sent an email to the local office and I didn't hear back, or I reached out, then I would reach out to my regional liaison. And similarly with DDS, if I sent a message to the examiner and didn't hear back, then I would reach out to the professional relations officer. What I will say, I think across most of the country, is that we do have professional relations officers for DDS and PAS, or public affairs specialists, for SSA. And they're really easy to get in contact with and often can help bridge those connections for you if you're reaching out and not able to get in contact. If you don't have some formalized process and community that exists already, and you're reaching out and not able to get sort of further, they tend to be the folks that are really helpful in bridging that gap.
Yes. And also when they, at least for my area, area 3, we communicate consistently. So they have our email. So if there's an issue, they send us an email. We're responding to that individual within, 24 hours or, one day or the same day to resolve any issues with non-responders and things like that. So we keep a good communications, with the field offices, liaisons, and, the coordinators and case managers. So we do a pretty good job, when it comes to that.
Unmute. Georgia, you had mentioned the regional meetings that are held with we facilitate them at the TA Center, but Sean represents Region 3, the Philadelphia region, and he said he's one of 9. So there's 9 regions. And one of the things that are shared during these calls are working through some issues, sharing what the process is, what's going on. We put things in context, what's going on at the local office level, at the area level. And one of the things Sean shares and some of the other regional communications folks share are contact lists. And Sean, can you go ahead and maybe talk a little bit about that? I know regions are different, but
Yeah. Well, let me tell you, there's actually 10 regions, but there's only 9 of us. Right? One regional communications director actually doubles for 2 regions. And she covers, like, listen, you talk about ground you got to cover. Alaska is in her is in her jurisdiction that she covers. So she covers more ground than a lot of our RCDs, including myself. But each region has a me, and each me has folks like Millie and others that are actually the front line folks that you'd actually contact. Where I come into play is when that has broken down. Hopefully everything continues to work in whatever area you're in and what your contacts are. But, things happen. People retire, people get transferred to different jobs. If ever there's a time that you lose that contact with that local person that should be helping you work through. So even if it's an office that say Millie's not in or a part of, she knows how to get in touch with those managers or the area directors that can. You don't have any help with that or you're not getting any response, then you come to me. And then I work to get you that proper contact, make sure that office responds to you and that you have what you need. I mean, it hurts us not to have that available to you because you guys are doing a lot of work to package things up to make it easier for us to help, right? And so it's a big help to us. So we want to make sure wherever those lines of communication have broken down, if that happens, or if you haven't had a good success in getting that started, that's where we come in to help work that out. And then hopefully from that point, it's on autopilot, smooth sailing ahead. It can work like it does between Millie and Georgie. But if it's not, then I want to know. I mean, don't think you're bothering me. I mean, that's what I want to know. If this is broken down in any way and that communication is not happening, I really need to know that because that could identify problems for us that we need to look at that extend beyond more than just SOAR. Right. So we really want to know if that's not working so we can get that done, get that fixed.
Pam, I also would like to suggest something that we actually did in DC. The SOAR team got in contact with the ADM and DC downtown, and they actually set up a meeting within the managers and to try to put a process together. I actually gave them, that the same type of process that we were using in Virginia, and they actually held a meeting with all the SOAR, leads and also with the manager for that office, and it worked out. They worked out something really awesome, outstanding that I think is working wonders. So I will suggest, that perhaps, if there's a way of getting in touch with those managers in the office and, request a meeting, where they can discuss how they can work, the SOAR and create that streamlined process, that will be something that it can be done, I will suggest something like that, if that works for anyone.
Yeah, I mean, Georgie and Kate, if you want to share examples of where you do hold meetings to work through some issues. Like I think it's, part of a healthy relationship, providing that feedback when things aren't going right. Maybe examples of being able to hold a meeting, especially if maybe some of the staff at your SSA office may be changing. It might be a whole new group of people now who are, taking over positions. How do you maybe reintroduce SOAR, to some of these folks through a SOAR orientation, or give an idea of when you've held meetings?
Yeah, so I can take that. I can say, in our state, I think all of us have seen just a huge turnover in staff during COVID. It's been really challenging for us. And one of the reasons we decided to have these regular, monthly, bi-monthly meetings, which occur with SSA, is to allow us, that's one of the things that comes up, local office staff change frequently. They get promoted into other jobs, they move on to do other things, and so they may not be forward facing. And so one of the things that comes up in our meeting is, have the contacts changed? So, is there a different person responsible for SOAR at the local office? What's their name? What's their information? And that information gets sent out to our SOAR workers through an email. And then similarly, brought up with SOAR workers on our regional meetings, where it's with SSA, DDS, and all of the SOAR workers, we can address sort of communication struggles or challenges. And I think it goes both ways for us. And I think that's the important of having these meetings, is that it's not always just that we can't get in touch with SSA and DDS. Sometimes it's that SSA and DDS can't get in touch with us. So it's important to sort of have those meetings and that set aside time to talk about like what's working well with our process and what do we need to sort of troubleshoot and figure out.
Yeah, and I'll just add, we had a great initial meeting that Millie is talking about, and we actually haven't met in person again since then, and that was 5 years ago now. But it's in part because we don't really need to be in person to reestablish what we've already created. I think that, and our manager, our regional manager, has changed as well, and we've had several people shuffle around. But again, it's remembering who those key people are, and if that person is gone all of a sudden, figuring out who the next key person is. So Millie, that's a lot of how we've built our relationship, because all of a sudden, all of our key people were on during COVID, and so that's when we put the bat signal up, and there you were in your Batman or your Batwoman outfit for SOAR, helping us just get through. And that's really where I feel like Miss Ford and I just started working on a ton of cases together. It felt like she and I were the only ones around just doing Social Security applications for a long time during COVID. And I think that just remembering, if your key person goes away, that you don't just have one key person, you have to remember who those other people are that you can ask. And so just in part, maintaining those relationships. And one thing that's happened as people have changed jobs, they are familiar with SOAR, so they remember, oh yeah, there's this thing called SOAR that happens. So we also, if Miss James is gone, we need to have a new SOAR person in the Postal Plaza office. And another thing that we try to do as the SOAR leads is keep an active list of who the SOAR providers are in DC that we share with each SOAR liaison at our local offices and with Ms. Ford, so that they know these are the people that are going to be most likely submitting SOAR applications. And if you have any issues with them, please reach out to myself or the other DC co-lead, so that we can keep the lines of communication going. And that's worked pretty well, especially when we couldn't meet in person. And also just because we know Social Security and DDS have a lot of demands. And so SOAR applications are a little bit of extra work in that you're giving part of it as a paper application. So they do have to, the liaisons are agreeing to take that on and do a little bit of extra work up behind the scenes. But because we have that same goal of trying to help people who are experiencing vulnerabilities to be able to submit applications successfully. So I think there's lots of workarounds. And again, it just kind of comes back to finding those key people and agreeing on what some of the workarounds you can create are together.
Pam, can I just jump in and like plug you guys for a second in this and say, it can be really hard to sort of, if you're just, I'm a worker in community and like trying to do these applications, and I am having difficulties of like getting through to people or sort of knowing what to do next. And I can say 100% a first step can be contacting your person from the SAMHSA SOAR TA Center and asking, like, how can you help me figure this out? Or contacting them and your state lead, how can we work on building these partnerships? Because when I walked into my job, none of this, this stuff didn't exist. And it's because I reached out to Abby, who was my partner at the TA Center, and was like, how can we do this? And it was like working with them helping us find contacts, using contacts that we were using in community to sort of start to develop these processes instead of trying to cold call into social security or DDS. And so if I can sort of plug the TA Center, they're amazing. They work with other people in the state that, are doing this work, and it can be a really fantastic place to start if these are the things that I'm running into in the community, but I'm not sure sort of how to start developing these processes.
Yeah. So Susie did share the link to how to get in touch with your SOAR TA Center liaison, who can help you find out if you have a SOAR procedure in your area, who your DDS contact is, who your SSA liaison is, and if there isn't one, how they can help you establish one. I think Joanne said it best. Don't be afraid to ask for help, right? We're all asking for help at every level of this process. We're asking for help. I know Sean asked for help, right? Sometimes. So we're all asking for help because we're in this together. We're all working alongside each other to submit quality applications, giving Social Security what they need to make, the best decision that they can. So again, look for that link. That could be your first step. I know there were many questions that were asking that. So hopefully you will send an email to your TA Center liaison, who then can connect you to, if you have a state lead. One person asked a question, how can I become a state lead? So we'll be reaching out to you for sure. So if you're interested in becoming a lead like Kate and Georgie, how you can go ahead and do that. And starting with your liaison may be the first step for you. So utilize that resource for sure. And then we can have some, calls together. If there is a local lead or a state lead, or you do have a Social Security contact, we can, have some informal conversations to start building these relationships together. So we are running out of time. And I just really want to thank you all for giving your time and energy, to be part of this. This is the beginning of a conversation that we'll be having with many folks out there. And if again, you look at we'll pull up the slides again, as we close out, we do have some resources that the links were shared here, but here are some active links to be able to access some of the tools that we talked about, how to start these conversations. Pull us in at the TA Center if you need, more support with having sometimes difficult conversations. We're happy to help you with that. There is an evaluation that at the end, we're gonna, take you, to this evaluation. Again, if you asked a question and it wasn't specifically answered, we will get in touch with you. We'll either send it over to the person that you directed it to, or we'll get in touch with you. So don't worry. And the evaluation, there is also another opportunity for you to pose a question if you didn't have a chance to do that. So do that then. So again, I just want to thank the panelists for sharing your time and your expertise, for helping SOAR work smoothly and helping us help each other, right, Sean? I love that saying. So we appreciate that, and look for our next webinar will be June 28th on serving individuals who are non-citizens and immigrants. So that's going to be a great topic. So look for registration information to come on that soon. So again, I want to thank everyone again for giving their time, and again, keep soaring, and we look forward to continuing this conversation. Thanks again. Bye-bye.